Have you been wearing bangs to cover your large forehead, avoiding swimming, or even been called five head all growing up? Then forehead reduction surgery, also known as hairline lowering surgery, may be the perfect procedure for you. And while this is the most rewarding procedure that I do, filled with lots of happy tears, it does come with some potential risks. Hi, I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I specialize in forehead reduction or hairline lowering surgery. Today, we'll take a deep dive into all the potential risks of the surgery, from the very routine to the more complex. Whether you're just starting your research or are scheduled for surgery already, I want you to be fully informed so that we can minimize your risks and help you make an informed decision about your care. So let's dive in. The first potential problem, like with any surgery, is bleeding, and the scalp is very vascular. So at the time of surgery, I do cauterize any blood vessels that are bleeding, and we use something in our local anesthetic called epinephrine, and that constricts all those little blood vessels. So that helps me avoid overly cauterizing the area, because what that can lead to is damage to the hair follicles. So I want to be very judicious with how much I cauterize. We don't want to damage those hair follicles so that you can heal properly. With that being said, you might have a little bit of oozing around the incision once all that epinephrine wears off, but I have not run into a situation where I've had significant bleeding afterwards, although it is possible, especially in those that have bleeding disorders that were never diagnosed, or if you're on blood thinning medications like aspirin, Coumadin, things like that, or are taking supplements that can thin the blood too. Omega-3 is one of them. Even drinking wine leading up to surgery or any kind of alcohol can thin the blood a little bit. So you want to be sure to avoid those things to avoid both bruising and bleeding after surgery. Another thing that can happen with any surgery is infection. This area is very clean. However, I do keep you on some antibiotics after surgery, and that's to minimize any kind of inflammation. One thing that can predispose you to infections after hairline lowering surgery is not removing the scab, any kind of scab that forms on the incision. That can harbor bacteria underneath there. And so I want you to shower after surgery, clean up all those scabs. I give you something called hypochlorous acid or puricin spray to spray on the incision, which kills any viruses, bacteria, fungus, yeast, anything like that, and helps reduce inflammation. And so I've never had any patient that had a very severe infection, maybe just a little inflammation in the area, but it's possible. The main thing that people worry about with hairline lowering surgery is scarring. And so when I make the incision, I make it right in the hairline, kind of jagged, and then it comes behind the hairline on the side so I can rotate the scalp over. It's very well hidden on the side, but in the front, I leave lots of deep sutures underneath the incision in the layers called the periosteum and the galea, and those layers of the scalp don't like to stretch that much, and that works in my favor because I put stitches that stay in about 3 months while the incision is healing, and they keep tension off the incision. And some surgeons, they'll use things like endotines or screws or put bone tunnels in to leave a permanent stitch to help take tension off. I find that that's not very necessary as long as I use enough sutures underneath the skin, because we want to take tension off that closure. Another thing that I do is something called platelet-rich fibrin injection at the time of your surgery. So we do a blood draw, spin it down in the centrifuge, and use your body's own growth factors and inject it all the way across your incision. And what that does is helps mature that scar tissue a lot faster and helps stimulate hair follicles to grow. I make the incision called a trichophytic incision. It's kind of beveled, and over time hair grows through it. As long as your hair grows in a forward direction, it'll grow through that incision and partially camouflage the scar. So right around the 3 to 6 month mark, I usually find that any redness that's around the incision starts to fade and hair is growing through it. So most people can't really see it after that point. Around the 2 week mark is when you can start covering it up with makeup and using some silicone scar gel, and that will also help it fade into the surrounding skin. Occasionally, I do have to do things like microneedling or laser treatments to help camouflage the scar, but those are really, really rare. And so I follow you over time to make sure that incision is healing properly. One thing that can happen if you are either a smoker or things that I've seen like in vegans or anyone with a plant-based diet, it's very difficult to get in enough protein after surgery. So I want you to get in at least 100 to 150 grams of protein a day, and that's very difficult. So starting about a couple weeks before surgery, I'll have you start supplementing with protein shakes with each meal, and that'll help you boost your protein stores, help you heal a lot faster. If you are a smoker, I'll have you stop smoking at least 4 to 6 weeks before surgery, and we'll do a nicotine test to help check to make sure you have no nicotine in your system, because that can delay healing, lead to open wounds, your incision can open up, and you can have more hair loss. And so I want to make sure your body is optimized for the best healing possible. One thing that can be variable between patients is pain. And most of my patients don't really experience much, if any, pain. I do long acting nerve blocks. You have a nerve called the supraorbital and a supratrochlear nerve here. I do nerve blocks called regional anesthesia at the time of surgery, and that helps reduce your body's sensation of pain even while you're asleep. And what we have found with regional anesthesia research is that helps with long term pain as well. So I do nerve blocks for that reason, and then I have you alternate Tylenol and ibuprofen after surgery. I do give you some stronger pain medicine after surgery, but most people only need it maybe 1 to 2 days at most, because it may feel a little bit like a tension headache right after surgery. But then that goes away, and then you can have some numbness both in the forehead and the scalp. Numbness is one thing that can be temporary or permanent. I don't generally elevate the skin near the orbital ridge here when I'm doing hairline lowering, unless I'm also lifting the brows as well. So I'm well out of the way of any nerves that can cause permanent numbness. But anytime you make an incision, you'll have at least temporary numbness where the nerve endings have to grow past that and through the incision up to the surface of the skin. This part back here, the crown of your head, is the last to come back, and it can take up to a year for that numbness to go away. I've never had a patient that had permanent numbness, although it has taken a while for some to fully regain their sensation. Another thing that can happen is something called shock hair loss, and that's also called telogen effluvium. It's more common in those that have a lot of stress. If you have a lot of anxiety, if you already have a lot of stress, like with work or with family or anything like that, it's better to be in a place where you can manage your stress effectively, either with meditation, exercise, things like that, because you can have hair loss even without surgery. And we even saw hair loss like with COVID, where the virus itself caused some shock hair loss. So if you're adding in an extra stress of surgery, that can cause even worsening shock hair loss. I don't see shock hair loss in everyone, but those are the situations where I find it more common. If you have shock hair loss, it's generally right around the incision, but can have some generalized thinning all over the scalp. You might just notice like a little more extra hair come out when you're brushing your hair. And I usually find that it doesn't get any worse after about the 1 month mark. And once we see where you're at the 1 month mark, it then starts to grow back over time. And it can take a full year for that to fully grow back. I did have one patient that shortly after surgery, she became pregnant. And because of her pregnancy, she had some shock hair loss from that. And but she fully recovered. She started using something called Nutrafol, which is a supplement that you can use to help with hair growth. You can also use things like Viviscal. There's a new hair supplement called Extrese that's really helpful. It's a gummy vitamin that can help more than a pill, because some people just really don't like to take pills. So if that's something that you're considering, it's good to start taking hair vitamins before surgery and continue them at least 3 to 4 months after surgery to make sure you fully transition to your more long-term recovery to see where you're at with hair growth. The last thing that I like to caution patients about is there's a possibility that I may not be able to lower your hairline as much as you need. If you have a very high forehead or a lot of recession temporally here, then I may not be able to get it in the most optimal position, because there's a limit to how much the scalp can move. In some situations, I can do a second stage procedure where I lower it even more. Or in most cases, I'll just recommend someone do a few hair grafts in the area, either on the side or right in the front, just to get them right where they need to be. Now, some surgeons use something called tissue expanders, where they place a little balloon under the skin and fill it with saline to stretch the scalp before surgery to avoid a two-stage procedure. And I can do that, but most of my patients don't want to go through that process because it looks like a big balloon in your head. So, to avoid that, I can do a second stage procedure after about 6 months to a year, where I can continue to lower the hairline even more. I had a patient about 2 years ago that required a two-stage procedure. She had a really high hairline from something called traction alopecia, and she wore wigs all the time to a point where the edge of the wig created inflammation and darkening of her skin called post-inflammatory hyperpigmentation. So after the first stage procedure, we got her about halfway there, about 3 centimeters. And then a year later, we went back and did a second stage procedure where I was able to lower her hairline all the way down to where she had that hyperpigmentation on her forehead. She was super happy, even though we had two surgeries. The downtime is pretty minimal with each stage, and so she was completely happy doing two stages, more so than having in a tissue expander. I hope these things were really helpful for you. If you have any other questions, please leave a comment below. And don't forget, if you want to schedule a consultation with us, call our office at 512-537-4191. And for sure, don't forget to subscribe to our channel for more helpful information.